Okay, we are here to get the job done. Good morning. Is it morning still? I've been up since like 5, I think, so trying to keep I've been to so many places throughout the day, so this is like probably the 5th or 6th, but who's counting? Thank you all so much for joining us here today. With me, I have Dr. Grant Colfax, who's the director of the Department of Public Health, as well as Dr. Anton Nagusa-Bland, who is the Director of Mental Health Reform, Daniel Lurie, the CEO and founder of Tipping Point Community, and Matthew State, the chair of the UCSF Department of Psychiatry here in San Francisco. And I'm really excited because these are incredible leaders in our community who are going to help us with some really challenging problems that we know we face as a city. Last week, we launched the Mental Health Reform Initiative to help those at the intersection of homelessness, mental illness, and substance use disorder in San Francisco. And through our detailed analysis of public health data, Dr. Nagusa-Bland and the Department of Public Health have identified the people in our city who are most vulnerable and in need of help. Now, to be clear, we see it, but now we have clear and accurate data. And of those 4,000 individuals, 41% frequently use urgent and emergency psychiatric services. 95% of those folks suffer from alcohol use disorder. 35% are African Americans, despite the fact that we have a less than 6% population of African Americans in San Francisco overall. So we have a lot of work to do ahead of us to provide the behavioral health care that people need, and we need partnerships to do it. We need to work with our state officials, with our philanthropic organizations, with our nonprofit communities, and that's why I'm here, why today I'm excited to announce that the city has partnered with Tipping Point Community and UCSF, who share our goals of addressing the mental health crisis in our city and providing people with the care that they need. We know that addressing the needs of the most vulnerable requires experts in the field. It requires collaboration and the development of public-private partnerships. Tipping Point and UCSF Department of Psychiatry came together to really understand how to improve the outcomes for San Francisco residents experiencing long-term homelessness, but who also have challenges with behavioral health. They worked with the city departments and various community-based organizations who helped to put together information to inform this comprehensive report, including the Department of Public Health, the Department of Homelessness and Supportive Services, the Hospital Council, PRC, and thank you, Brent Andrews, for being here and your amazing work, Health Right 360, and thank you again for your rigorous work on what we deal with in terms of treatment for folks who also sadly deal with substance use disorder as well. Thanks to the rigorous research conducted by Tipping Point and UCSF, we have a report that we can use to implement data-driven policy decisions that will effectively work and change our city for the better. This report highlights how philanthropic and private sector funding can work hand in hand with public funding to help San Franciscans suffering. They have provided several recommendations to improve our system coordination because we know that it definitely has a few holes in it and it needs to be better coordinated. Enhancing people's access to treatment, meeting people where we are. We can't just think they're just going to show up at the door of a location for help or for support. We are going to need to go out there in the streets and meet people where they are. Engaging more people in care and services. And we are excited to partner with them to implement these recommendations. But also in order to address the mental health crisis in our city, we need to build on what is already working. And we're going to do that in part by expanding the number of Hummingbird beds in our city. And today, I'm really pleased to announce that thanks to the funding from Tipping Point, we'll be able to add 15 new Hummingbird beds, which offer psychiatric respite. And that is absolutely amazing, and it's really expensive. So with these new beds, we'll be able to connect people experiencing homelessness with behavioral health needs, the care that they need. And I'm not sure if any of you have visited the Hummingbird facility at SF General, but it is absolutely amazing. I had an opportunity to not only touch bases with clients, but we also did an announcement last year expanding the number of beds at that location as well. And to hear someone say to me that I'm trying, it's hard, but I'm glad to have help, it makes all the difference in the world. And this is an incredible facility, and I'm so proud of the work that they do. As Dr. Nagusa Bland will get into more details, we know that the vast majority of the 4,000 people we have identified, unfortunately, have alcohol use disorder. The Tipping Point report includes some innovative suggestions for treating those suffering from alcohol use disorder, and we are looking forward to making some changes and implementing some of these in the coming months. There will be more announcements to come, and Dr. Nagusa Bland will continue to evaluate our approach to mental health care, because that's his job as the director of the mental health reform in our city. We will recommend more ways to improve care for our city's most vulnerable residents, and we all, as I said, need to work together to address this challenge that we face with policy, with investments, financial investments, and working in a collaborative approach. And so we truly appreciate the partnership of UCSF and Tipping Point. And now I want to turn this over to Daniel Leary, who is the CEO and founder of Tipping Point Community, who they've done a lot of amazing work in helping to address homelessness, and they're really taking it a step further by digging into the root causes of some of the challenges we face to make the right kinds of investments. This is going to make a world of difference. And ladies and gentlemen, Daniel Leary.
Thank you, Mayor Breed, for your leadership, for bringing us together to confront this critical challenge facing our community. We know that the primary cause of homelessness is a lack of affordable housing. But we also know that behavioral health conditions like mental illness and substance use disorders contribute to homelessness. And without a stable home, these conditions are far harder to treat. In partnership with UCSF's Department of Psychiatry, Tipping Point engaged a public health consultancy called John Snow Inc., JSI, to identify opportunities to improve San Francisco's existing behavioral health system. We convened leaders from city departments, from UCSF, from SF General Hospital, and a variety of community-based service providers. We conducted dozens of stakeholder interviews, including a focus group of the clients at the Hummingbird Place Psychiatric Respite Center. We engaged closely with the Department of Public Health throughout the process, checking assumptions and findings against the experience of our city partners. And now, as the mayor said, the findings are in. We need to know the names and needs of everyone who is homeless with a behavioral health care need, provide wraparound services that promote stabilization and a path to permanent housing, and ensure that systems and services proactively address and reduce disparities, especially among Black and LGBTQ individuals experiencing homelessness. Tipping Point's role going forward will be to fund the priority investments in the Department of Public Health and the service community, while encouraging our philanthropic partners and peers to do the same. We are taking the first steps towards making this vision a reality, and today we are announcing that Tipping Point will invest up to $3 million to to create a second Hummingbird psychiatric respite center, replicating their As the mayor said, this is the type of program that you want to replicate. It's an innovative model, and it works. This will expand access to a critical supportive step out of homelessness. We invite all our other funders and friends throughout the city to explore the report findings that are out today and invest in the recommendations and join us. Now I'd like to introduce two people that are working every day to improve the health outcomes of our neighbors. Please join me in welcoming Dr. Anton Nagusa-Bland, who's the Director of Mental Health Reform for Mayor Breed, and Dr. Grant Colfax, the Director of Public Health.
Thank you, Mayor Breed, for leading the way. If we're going to reform our system of care for the nearly 4,000 San Franciscans who are most in need, everyone will have to work together. That's why it's so important to be standing here with our partners at Tipping Point and UCSF, talking about these common goals we share and advancing our shared vision. I want to briefly highlight a couple of findings in this report that reinforce our own. First, behavioral health outcomes are health outcomes, and they are far worse for people of color. This report points out that Black men die at almost twice the rate of white men from liver cirrhosis, even though they have lower rates of alcohol use disorder. We also found, as Mayor Breed described, that among San Francisco's population of nearly 4,000 people experiencing homelessness, substance use problems, and mental illness, 95% of these individuals have an alcohol use problem. Alcohol does not get as much attention these days as opioids and stimulants, particularly methamphetamine, which are very important problems, but alcohol remains a persistent and enormous public health issue that impacts the lives and health of many San Franciscans. Our most recent community health needs assessment revealed that 2 out of 5 adults surveyed reported a history of binge alcohol use. Between 2014 and 2016, over 8,000 emergency room visits resulted from alcohol-related issues. We can help. We know how to care for alcohol use disorders. We have already begun to work on the kind of evidence-based approaches to chronic alcoholism that this report recommends, and particularly exploring the development of a managed alcohol program. The research is very strong that managed alcohol programs, medications, and treatment can reduce the harms of excessive alcohol use. We can create safety and stability for people if we innovate on this problem together. We need to make sure that proven solutions are applied in a thoughtful way and extend their reach to people who have not had sufficient access to the help that they most need. We also agree with the report's findings that we should make it easier to get real-time data about our system of care. We are launching the very kind of collaboration across city agencies that this report urges us to pursue. We expect to be able to provide these transparent information as information about our beds and our availability of our beds and our system of care to the providers, clients, and members of the public so that all of us have a better understanding and have an improved ability to access care. We know that research and philanthropy will play important roles in making these recommendations a reality, and we are grateful for that support and partnership.
Well, good morning, everybody. I'm Grant Colfax. I'm the Director of Health, and I'd like to thank Mayor Breed for her leadership, UCSF and Tipping Point for the ongoing and strengthened partnership that they have with the department, and of course, Dr. Nagusa-Bland for his bold leadership in his vision for us to do even better as a community as we address the intersection of homelessness and behavioral health issues. This is an important day. We are coming together, focusing on solving problems and improving health for the population of nearly 4,000 San Franciscans who are experiencing homelessness, mental health, and substance use disorders. And today, we announced a significant commitment of partnership to meet those goals. A population focus means not only a focus on the treatment of the individual patients, but we look at the big picture. We change the way the system responds when a public health challenge is this great. We learn. We look at the problem from multiple angles. We draw on clinical expertise and data. We try new approaches. We learn what works. We stop what doesn't. And we measure results, and we build a track record of success. We figured this out when we took on HIV, that this is what it takes. Look at the numbers just released this week. We have gone from being ground zero in the AIDS epidemic to pledging to be the first city to get to zero. That didn't happen overnight. It took multiple stakeholders from across San Francisco, and we need to use that experience to address other deep health challenges in our city. Progress does not happen and cannot happen in isolation. As with HIV, we know that forging behavioral health solutions for San Francisco's residents experiencing homelessness and serious behavioral health issues will take researchers and clinicians, care providers, community stakeholders, clients, philanthropists, city leaders, and the support of the public. We are grateful for the leadership and contributions of Tipping Point and UCSF, these two robust institutions that we're fortunate to have here in San Francisco. The health department looks forward to partnering with them and many others on the significant behavioral health challenges facing people experiencing homelessness in San Francisco. Together we can and we will heal our city. Thank you.
Thank you. Now, I don't know if any of you caught this, but Jon Snow, Inc. did the report. You know nothing, Jon Snow? Nobody caught that? Jon Snow, Inc.? Okay. Next up, we have Dr. Matt State from UCSF.
Thank you so much, Mayor Breed. And truly, I am thrilled to be able to stand here today with a group of leaders who are so dedicated to this city and to the most pressing social problems we face, including chronic homelessness. More than 30 years ago, at the height of the AIDS crisis, local government in San Francisco, healthcare providers, academia, philanthropy, nonprofit community activists set aside parochial differences and came together to attack what seemed to be an insurmountable challenge. And as you've heard just this week, Mayor Breed stood with leaders of the Department of Public Health, UCSF, to review the remarkable progress that has been made in this struggle and to redouble efforts to work collaboratively to be the first city to get to zero, something that must have seemed impossibly out of reach 3 decades ago. This is the inspiration for our efforts, and it's the model that we are pursuing to address the intersection of mental illness, substance use disorders, and homelessness. This critically important report from Jon Snow, Inc. is the product of the city, philanthropy, the university, all coming together to help develop a consensus roadmap that promises tangible, immediate differences in the lives of individuals and families experiencing psychiatric illness and substance abuse. The diverse input that went into this, as you've heard, included homeless individuals, clinicians, other service providers, nonprofits, cross-agency city leadership and staff, and many others. I can't thank Mayor Breed, Director Colfax, and Dr. Neguse-Bland enough for your leadership and for your inspiration. And to Daniel Lurie and the Tipping Point folks, where are they? It's been a remarkable partnership. We're tremendously grateful at UCSF. There are several other people who I want to mention. First, I'd really like to underscore a tremendous contribution from Jane Hawgood and John Pritzker, not only for their commitment and their insights, but for their vision that helped launch this collaboration and bring us all together. And to Susan and Bill Obendorf for their support for Tipping Point, for the Chronic Homelessness Initiative, for UCSF broadly, and for the Department of Psychiatry. As you've heard today, it will be the partnership of academia, the city, and philanthropy that really promises to allow us to move forward on a critically important and admittedly extremely difficult challenge. UCSF and the city have a long partnership beginning 150 years ago when UCSF doctors began caring for San Franciscans in the city's general hospital. Today, UCSF clinicians continue to care for the city's most vulnerable, including children and adults, at San Francisco General Hospital, and in a range of outstanding community-focused programs for those suffering from mental illness and substance use disorders, from our Division of Citywide Case Management, our Division of Substance Abuse and Addiction Medicine, our Trauma Recovery Center, the Alliance Health Project, our Psychiatric Emergency Services, to name just a few. As chair of the Department of Psychiatry at UCSF, I could not be more proud of our people and of our longstanding partnership with the city that has allowed us to work every day to make a difference in the lives of our patients and their families. As a representative of UCSF here today, I can't stress enough our commitment to collaborate in taking on these big challenges. Our Department of Psychiatry, the new Benioff Homelessness and Housing Initiative directed by Margot Cushell, who's here today, our students, our faculty, and trainees are all determined to work together to find ways to tackle the most pressing health and health equity challenges we face, including the nexus of mental illness, substance abuse, and homelessness. So thank you again, Mayor. Thank you again, Director Colfax, Dr. Nagusa-Bland, and Daniel for your tremendous partnership and efforts.
So there you have it. Let me just say that we all know that the challenges that we face as a city weren't created overnight, and there won't be any easy fixes. It will take time. It will take, as every speaker here has said, collaboration, working together, seeking out the professionals who have the expertise in the medical arena and the nonprofit sector, our policymakers, to provide the right kinds of solution. This is so critical because when we look at homelessness and the challenges that sadly around 4,000 residents of our homeless community face, we know that it's not just homeless people who are dealing with a number of these issues in terms of behavioral health. It is time that we take just a different approach towards addressing behavioral health challenges in our city and in our country, that we begin to get rid of the stigma attached to seeking help for people who sometimes are dealing with depression and other issues that continue to plague our society. One of the things that I am really committed to is making sure that we have wellness centers in all of our high schools in San Francisco, all of our schools in general, so that when kids are dealing with trauma or any other kind of situation, that they have the help and the support that they need in the place where they study and learn every single day. Looking at creative and innovative solutions is how we are going to create a city that is healthy and is thriving. And I want to thank all of you for the work that you have done and will continue to do to get us to a better place. With all of these leaders, all these amazing people, all these incredible minds, I know it's only a matter of time before we get to that better place that we deserve to be. So thank you all so much for being here today.